Chris Bowling.
Chris Beyer.
Dutch Rojas.
Dutch Rojas. We're in week number 2. Dutch, thanks for coming back. It's amazing how we're all wearing the same exact shirt, right? And here we are 1 week later. But we are once again so excited to have you back. You know, we touched a little bit about your background, which once again, I think you have a great story about how you came to this country. You know, you served, our country in the military. And you started Sano, and Sano was really a company to build those bundled bills through providers, correct? That's really how.
That's it.
Okay. Yep. And then I remember when I got introduced to Sano, I said, hey, this is great. You need a TPA, right? Because we got to figure out how we get claims to run through. And you're like, yep, I've got that. And that's Everyone Health. And you know, a lot of our stuff under the VIP network is branded both, right? We've got the Everyone Health brand, and then we've got the VIP network brand, but you've got some exciting news. You guys took on a new partner. Tell us about it.
Yeah, I mean, I think it's great. In July of just, I guess, almost 2 months ago now. Yeah. No, month and 2 weeks ago, we were acquired by Nomi Health. That's No Middleman Health. It's relatively a new company, startup. They made their way by providing COVID tests, building labs all over the country, and doing business when our country needed the most. They were the go-to, like where all the tents are that were in your city, by your churches primarily, or your temples. They provided the nurses, and the nurses provided the COVID tests you could drive through, and then they provided the vaccinations.
Wow.
And
that's
so
big undertaking.
For a startup, they did a pretty good chunk of business.
For sure.
And, yeah, so I met the CEO probably 2016, I think is right, through a mutual friend of ours. And he told me, he said, you know, the company you started, that's what I want to do. And so when I got a phone call from him a few years later, during the pandemic, he was like, hey, I still want to do what you do, except now I'm going to buy you. And I was like, well, okay, let's see if you want to have that conversation. So
COVID.
Yeah. I'm like, well, wow. you jumped ahead of me pretty quickly there, buddy. So yes, I think especially for Assured Partners, I think our VIP network, Everyone Health clients are going to benefit by tech and resources, right? Yeah, technology, as we all know, is deflationary. It's generally going to be something that can help people get things done that they want done way better than a human interaction can.
Yeah. Well, so you're just talking about making it easier for an employer or their family to access care through the network, get the bundled pricing done, waive their cost, just make it a simple process for them, right? Easier to access. Yeah.
And did Nomi buy Artemis, or was that part of that deal? Or
so they bought Artemis about 6 months before they bought us.
Okay.
You know, Artemis is a claims analysis company. That's what I would call it, as what Sanjay or Grant would say. They've got 550 self-funded clients. And so the solution for Nomi was, hey, we own Artemis. Artemis identifies problems and challenges within the healthcare spend on the PBM side and the medical side.
Yep.
As Chris knows, because I've said this to him 100 times, I don't know anything about PBM. Everybody keeps sending me these Mark Cuban articles, and I'm like, good for Mark. Right. I don't know anything about PBM. Stop asking. Yes. So, but the nice thing is they've got a medical spend over there, you know, at their 500 plus, and they realized, holy crap, if we had a direct contract network, we could solve the problem for those clients.
Yeah, because they're identifying where costs are out of control for the same procedure. And now we're saying, let's bring it all under one bundled price and be consistent. Like you said, predictable, as we talked about last week.
Yeah, the interesting thing is the claims analysis. Now, it used to take, and Chris will tell you this, it used to take me like a month to do an opportunity analysis.
Yes.
Now it's down to a week.
Yes.
And our goal by the end of Q1 is to be able to basically do it. You know, if somebody says, here's my data, we should be able to run the report pretty quickly.
And that's probably why we are so excited about this new partnership, is that, you know, you kind of knew where you needed to get some resources. You knew the cost of that was going to be tremendous. I mean, one of our competitors out there, one of your competitors, has spent a ton of money building, you know, data resources and data analytics. And, you know, I kept referencing that company back to some of your teammates, and I think you guys found, the perfect partner because they've got a proven technology platform that we can build on. The other thing I love is what you just said is it's not just around a bundled payment, is they're analyzing the entire claim spend and then coming back and saying, hey, this is where we think we can really help in these 5 areas. Not we've got this great solution that's going to fix everything, but we can help that employer to determine where can we get the biggest bang for our buck. And that's what I'm so excited about this partnership. So
yeah, and some employers, as you know, struggle with maternity expenses. Some don't. Some employers struggle with infusion drugs. Some don't. I mean, so you've got some, what I would call high expense claims, right? That need to be done on a bespoke, tailor-made business.
Right. Yeah.
So we can do that. I can attack those things and assign human capital to those things, but I don't want to assign human capital to a bunch of lab tests.
Right.
Or a bunch of commodity items.
Right.
Yeah.
So I think, no, I'm super happy. I think the way forward is, it's coming.
Well, I can tell you, Dutch, we're going to have you on many, many times. We were actually just talking about LinkedIn Live has, some neat ability.
I'm so excited about that.
Limited to 10 minutes, and plan on us inviting you back many more times because I believe you've got the pulse on where healthcare is going, and we are so fortunate to have you as one of our partners. So thank you very much.
Thank you for partnering with me.
I want to finish up with one question though for you, and this is our typical In Focus ending question. Give us your philosophy for life or business. You've had a great background, which you shared last week. Certainly you're changing the healthcare landscape, but what do you operate by, Dutch, as you look at your philosophy?
Look, if I could culminate the thought into one sentence or two, I would say that putting buyers and sellers on sure footing and making sure that one party doesn't have control over another is the most essential thing we do. There's a very famous writer that calls it the asymmetry of information. But bankers make money more than people do because bankers have better insight and better information. And I think what we want to do, and this is why I love my partnership with Chris, is because we're trying to make it so that the buyer and the seller both know what each other's interests are and how they align.
Amen.
And so that's my basic philosophy, that asymmetry of information ought to be on both sides.
I like it. That's a great way to appreciate it, Dutch. Good to talk with you.
All right, great to see you guys. Talk soon.
Thanks.
All right, take care.